However, that preparedness was inadequate for a global pandemic of the kind that struck. The institutions and structures responsible for emergency planning were labyrinthine in their complexity. There were fatal strategic flaws underpinning the assessment of the risks faced by the UK, how those risks and their consequences could be managed and prevented from worsening, and how the state should respond. To give but one vitally important example, one of the first lines of defence to a pandemic is containment, and this requires a system of test, trace and isolate that can be rapidly scaled up to meet the demands of a major outbreak. This did not exist in the United Kingdom when the COVID-19 pandemic struck. The UK government's sole pandemic strategy from 2011 was outdated and lacked adaptability. It was never, in fact, properly tested. The UK government neither applied it nor adapted it, and the doctrine that underpinned it was ultimately abandoned, as was the 2011 strategy itself. I have no hesitation in concluding that the processes, planning and policy of the civil contingency structures across the United Kingdom failed the citizens of all four nations. There were serious errors on the part of the state and serious flaws in our civil emergency systems. This cannot be allowed to happen again. The inquiry's Module 1 report recommends fundamental reform of the way in which the United Kingdom government and the devolved administrations prepare for whole system civil emergencies. I make 10 far-reaching recommendations concerning the system of civil emergencies. The central recommendations, in summary, are a radical simplification of the civil emergency preparedness and resilience systems. This includes rationalising and streamlining the current bureaucracy and providing for better and simpler ministerial and official structures and leadership. A new approach to risk assessment that provides for a better and more comprehensive evaluation of a wider range of actual risks. A new UK-wide approach to the development of strategy, which learns lessons from the past and from regular civil emergency exercises and takes proper account of existing inequalities and vulnerabilities. Better data collection and sharing in advance of future pandemics and the commissioning of a wider range of research projects. The holding of a UK-wide pandemic response exercise at least every 3 years and the publication of the outcome. The bringing in of external expertise from outside government and the civil services to challenge orthodoxy and guard against the acute problem of groupthink. Lastly, and most importantly, the creation of a single, independent, statutory body responsible for whole system preparedness and response. It will consult widely, for example, with experts in the field of preparedness and resilience and the voluntary, community and social sector, and provide strategic advice to government. Some of the core participants have suggested I make many more recommendations than the 10 I have made. I am indebted to them for their assistance. However, the inquiry team and I have identified what I consider to be the 10 most significant recommendations which I believe can be implemented swiftly and at a reasonable cost, and, if implemented together, could make a real difference to the preparedness and resilience of the United Kingdom. Each of the recommendations in this first report is important in its own right. But in my view, all the recommendations must be implemented in order to produce the changes that are necessary. I welcome commitments made by leading politicians to consider carefully, and I expect implement, the recommendations made by inquiries such as this one. I intend to monitor progress, and I have asked the inquiry team to liaise closely with the relevant government departments and bodies. I will expect each organisation that is responsible for implementing my recommendations to set out within 6 months how it plans to respond. I emphasise that many of the other issues of real concern to members of the public will be examined more fully in later modules of this inquiry. More reports and recommendations will follow. They include reports and recommendations relating to the core political and administrative decision-making across the United Kingdom, the impact of the COVID-19 pandemic on the health and care systems in the 4 nations of the United Kingdom, the adequacy, supply and distribution of PPE, the use of DNA CPR notices, vaccines and therapeutics, test, trace and isolate policies, procurement, the economic response from all 4 governments, the impact on children and young people, and the impact on the population of the UK more widely. Unless the lessons are learned and fundamental change is implemented, the human and financial cost and sacrifice of the COVID-19 pandemic will have been in vain. The harrowing accounts of loss and grief given by the bereaved witnesses and others who suffered during the pandemic serve to remind us why there must be radical reform. Thank you.
Let's bring in Tom Clark, who, as we saw earlier, is outside the COVID inquiry and joins us with his take on, I guess, what's been out in the report that has come out, but also what we just heard from Baroness Hallett. I mean, saying that radical reform there at the end is needed and she expects all the recommendations to be implemented quickly. Some of the recommendations, I'm scanning the report now, are significant. They don't all sound that radical. There's things like a new approach to risk assessment, better systems of data collection, bringing in external expertise. I guess linked to that part of my question, Tom, is the fact that they're saying these recommendations must be implemented, but it's part 1, I think you said, of 7 parts. Presumably there'll be more recommendations to come, and it just raises the question as to whether things could have been done in a more tied up and, I guess, swift fashion.
Well, I mean, to be fair to the inquiry, they have turned this report around in a year. They have got, and they're running the other modules, the other parts of the inquiry in parallel. So given the enormity of what they're trying to get through, they are working extremely fast, but it is going to be quite a while. We don't expect them to conclude hearings until 2026, and then we expect reports to come out, though, as each module is completed, like this one. And in that sense, this is the final report on this particular bit, the planning, the systems, the processes, the civil contingencies type stuff. I think for a lot of the families of, let's not forget, 230,000 people and counting who've died of COVID, 2 million people living with long COVID, the hundreds of billions of pounds to taxpayers and the costs of the impact, that's not even including the economic disruption to other businesses, for example. They are, what they want to hear, certainly the families, they were, I think, hoping in terms of accountability to hear names named, who individually was at fault. It's perhaps right not to expect that in this particular report of the inquiry. This is looking at those systems and processes and contingency plans. And there is, let's face it, plenty more blame to go around and plenty more into the political decision-making and the scientific decision-making that happened during the inquiry itself, during the pandemic itself, when the inquiry reaches those points, so we'll hear that. But the other key thing, and I was speaking to the families only yesterday, they were calling for, is to see that these recommendations are acted upon and implemented. And we heard Baroness Hallett saying that just now. We heard similar calls from the infected blood inquiry, which again made very important recommendations to improve safety going forward. And we currently haven't got a mechanism in law in the UK to ensure that governments are required to act upon the recommendations of inquiries like this. And for something as significant as the pandemic, and as you heard from Baroness Hallett there, the impacts that has, both in terms of human loss but also financial impact, it would be important that those are acted on. So there's certainly going to renew the discussion for some kind of mechanism to ensure that recommendations from big, expensive inquiries like this actually get put into place, acted on and implemented.
Tom Clark, great stuff. Thanks so much for that.